talking about probably the most dreaded disease for every mother, father, parent, child, sister, relative. Something nobody ever wants to hear anybody, friend or foe, has. So cancer. We know it's a silent killer. And for many markets and demographics such as South Africa, cancer is often a late stage diagnosis.
A lot of patients who come to our hospital, who by the way come from near and far, the 14 hospitals that refer to us, other provinces that refer to us, is very important. On an annual basis, we diagnose about 4,500 new cases. And this is done through a multidisciplinary approach, where in many of the clinics where patients have a potential to have cancer, the question is asked to the patients. As an example, about 2 years ago, the radiation oncologists are working with the medical doctors in other areas to purposely ask men about their prostate cancer. And we have seen a rise in the diagnosis of prostate cancer since we started proactively in asking men about their status. The second part that we try to do, we also do mammograms for breast cancer, because these two cancers are the ones that are really treatable if diagnosed early. So many departments are really trying to encourage people to know their status, but once you know your status, they also help you where to start in terms of this disease.
In some of the interviews, we have spoken with some of the professors and radiographers and nurses, and just the simple smile on their face showing their excitement. So what do these machines and any state-of-the-art equipment, what does that mean to you?
This is new technology that is out there in the whole world. It is a state-of-the-art machines, but these machines are actually much more focused in terms of treating the patients, and I'm told that the technology that is in this machine, it actually goes directly to that small little cancer cell that is there, and if in the event the patient moves a bit, it actually stops because it only wants to radiate what is a cancer cell only. So that is really amazing in terms of the work that we will be able to do with these new machines.
And if I just follow on, the staff, what's the feeling for the staff? The patient ultimately receives their care from the radiographer, from the nurse, from the orderly. And the smiles we've seen, they're excited. I know that if I'm being treated, the person who's the first caregiver, that smile, that experience radiates. What does it mean for your staff?
Everybody's excited. You should see the staff morale in the department. Very committed, passionate, and compassionate team of employees. I can't complain about that.
I was diagnosed on the 16th of June with a epidermoma tumor of the brain, and it was causing a lot of pressure, which means he was disorientated, vomiting, complaining of severe pain. They did the MRI, they did confirm that the operation is needed. Operation was done 7.5 hours later. They did confirm that the radiation will be needed to remove some of the remaining cancer cells that are there. The operation couldn't remove it 100%. So they then decided the radiation will start, which was 32 days of treatments. It was very difficult in the beginning to try and get him to accept the treatment. The mask is very terrifying for him, so it was a struggle in the beginning, to be honest. But he's now so used to it. Every day he is asking when is he going to go do his mask, and he's calling everyone downstairs, his friends, which is great. And I'm being honest, I was in private care for about 4 days before we actually were transferred to Joburg or Charlotte Maxeke. So, but he was, I got way better treatment here than I got there. But downstairs especially, they've made it very easy to go through this. I'm so sorry.
Thank you, guys. Thank you to the whole team. It's been great. Cancer is a difficult campaign where you need to maintain momentum, but it's physically very hard to do. One, because of the multitude and complexities that cancer has. But that being said, there is still the necessity to maintain awareness. There's still the necessity to teach and to say to women, feel your breasts. To say to men, check your prostate. Those are the cancers that are becoming more and more common, but people are oblivious to it. So as an institution, as an academic institution, can you tell us a little bit about the programs and the consistency with which you are seeking to maintain awareness campaigns?
We have a lot of our patients who are survivors, who come on during their personal time to come and talk to the patients who are waiting in those areas, to tell them about that cancer can be cured and what must you do to assist yourself. And also to educate the families that when somebody has cancer, it's important to have that family support.
So masengithole ukuthi ngiphethwe yini, it was scary ngoba that time bekuthiwa mawune cancer uzofa nokufa, removing a breast you won't survive, things like that. But I took my chances ukuthi let me deal with the situation. Hamba radiation wasn't that bad if you follow instructions ukuthi ungagezi nginsipho in. So that went well. Ekugcineni I had to accept it. Ngiyamukela ngiqala futhi leyo process leyo ukuthi ngi-undergo zonke lezi sebengizihamba abo chemo, radiation. Manje semi-check up nje, general check up. They would hear me mangikhala ekamereni. Ngangihagi ngapha nangapha. We cry together. So besikhona ukundlula kuleso simo leso. Kunzima but we managed. You're right, I've survived a lot. I'm not gonna die now, not anytime sooner, at my 64 years. I'm strong. I tell people, if ever you've been diagnosed, you can get a death sentence. Yithi our minds tell us that. Nabantu abasitshela ukuthi hey ini uzofa in nami. I was scared at first, but now I'm okay.
But when it comes to cancer, for example, the breast cancer, we have a one-stop shop. If you come today at Charlotte to be diagnosed, by the time you go home, you will be knowing if you have a potential of cancer. And it's through multidisciplinary work of the surgeons, the radiologists, the radiographers, the oncologists, radiation oncologists, that work together to ensure that the early detection of the disease is taking place. Lastly, as a teaching hospital, we have a lot of research that is going into the latest treatments in cancer, how it impacts on other diseases, and most of the research actually does influence policy in terms of the outcomes of this research that has been done as a teaching hospital.